Hello, and welcome to the Anxiety Reset podcast. I'm Neil Robson from Fabric Hypnotherapy, and in each episode, we'll take a straightforward look at anxiety, what is happening, what may be keeping it going, and what you can begin doing differently to help. This podcast is for education and general support. It's not a replacement for medical advice, a diagnosis, or individual mental health treatment. So, in the last episode, we looked at why anxiety can feel worse at night, when the distractions stop and your attention turns towards your thoughts and physical sensations. Today, we're talking about something that can be particularly frightening. It's intrusive thoughts. These are thoughts and images or doubts or urges that enter your mind without being invited. They may be strange, upsetting, could be embarrassing, and sometimes they're completely out of character. And because they feel so uncomfortable, you may start asking yourself, why did I think that? What does it say about me? What if the thought is important? What if it means I secretly want something? What if I lose control? You may then spend hours trying to answer those questions. But the more you try to reach complete certainty, the more important the thought can begin to feel. So in this episode, we're going to look at why intrusive thoughts become stuck, how our attempts to get rid of them can accidentally strengthen them, and then we'll look at a practical way to respond without getting pulled into a long mental argument. So this episode is about unwanted thoughts that cause fear and distress. It's not about genuine plans or intentions to harm yourself or somebody else. If you feel at risk of acting on a thought, you should seek professional help. Let's begin with what an intrusive thought actually is. An intrusive thought is something that appears automatically. You don't sit down and consciously decide to create it. It may appear as a sentence in your mind. It could be a sudden image. It could be an uncomfortable doubt. Could be a memory. Or it might be a feeling that something terrible might happen. And the subject of the thought can vary enormously. Some people may become frightened that they might make a serious mistake. Some worry that they could cause harm without realizing it. Some experience unwanted thoughts about their relationships, health, their identity, religion, sexuality. Others become frightened by sudden images or impulses that feel completely unlike them. The particular subject is not what keeps the cycle going. What usually keeps it going is the meaning attached to the thought and everything that then happens afterwards. So imagine you're going about your day and a strange thought suddenly enters your mind. And for a moment, it catches your attention and your body reacts. You may feel that feeling, that drop in your stomach. Could be a rush of adrenaline, a tightening in your chest, a sudden feeling of dread. And your mind then says, why did I react like that? And now the investigation begins. You replay the thought. You examine how it made you feel. You try to remember whether you have ever had a similar thought before. You might compare it with your values and your past behavior. You might search online. You might ask somebody you trust to reassure you. You may begin to avoid certain people, places, objects, or situations. You might replace the thought with a more acceptable thought. You may repeat a phrase in your head until you feel calmer. You may keep checking your physical reactions to see what they mean. And for a short time, one of those actions might bring some relief. You might feel better, so it appears to have worked. But your mind may also learn something from that response. It learns that this thought must be important. It learns that when the thought appears, you must stop what you're doing and investigate it. And because the brain has now marked the thought as important, it becomes more likely to check for it again. The thought returns, the anxiety returns, and the investigation begins again. And this can become a loop. An unwanted thought appears, the body reacts, you try to work out what the thought means, you check, analyze, avoid, or you seek that reassurance, and you feel temporary relief. Then the thought returns, often with a new question attached to it. The mind might say, but what if you miss something? What if this time is different? How can you be completely sure? This is why logical answers often don't end the problem. You may answer one question and the anxiety creates another one. You reassure yourself about one detail, but then the mind finds a different detail to examine. The problem is no longer the original question. The problem is the demand for that certainty. Anxiety wants an answer that leaves no room for doubt. But we know that very few things in life come with that level of certainty. The more certainty you demand, the more uncertain you begin to feel. One of the biggest misunderstandings about intrusive thoughts is the belief that recovery means preventing the thoughts from ever appearing. And that sounds reasonable. Surely if a thought upsets you, the answer must be to get rid of it, right? But trying to force a thought out of your mind means you must keep checking if it's still there. You might tell yourself, I must not think about this. Then a few seconds later, you check. Am I still thinking about it? Is it still there? And the moment you check, you've brought the thought back into your awareness. You can also become frightened by the fact that the thought returned. You might think, why am I still having this thought? I thought I dealt with it. Does the fact that it returned mean something? But thoughts can return simply because you've trained your attention to look for them. Imagine someone tells you that an alarm may go off at any moment. Even when the alarm is silent, part of your attention remains focused on it. You're listening for it. You're waiting for it. And every small sound gets noticed. Intrusive thoughts can work in a similar way. You become watchful. You scan your mind to see whether the thought is present. And that mental scanning keeps it very close to the surface. The alternative is not to prove that the thought is harmless. It's not to find the perfect sentence that makes you feel completely certain. And it's not to replace every uncomfortable thought with a positive one. The alternative is to change your response. So you begin treating the thought as something the mind's produced rather than as a question that must be answered. And that can feel difficult at first because the anxiety may still be present. Your nervous system may still demand that you do something, but feeling an urge to investigate does not mean you have to follow it. You can notice the urge without completing the usual response. So here's a simple process you can practice. It's notice, name, don't solve, return. So we'll just go through it slowly. So first, notice. An intrusive thought appears and it catches your attention. And instead of immediately entering the story, just pause for a moment. You don't need to push the thought away. You're simply noticing that something has appeared in your mind. You might say to yourself, I've noticed a distressing thought. The second step in this is to name it. Now, you're not naming the detailed content, you're naming the process. You might say, this is an intrusive thought, or my mind is asking for certainty again, or this is the anxiety investigation just beginning. But you can keep the label simple, whatever you feel right. You don't need to repeat it until you feel better, because that could become another form of reassurance. You say it once and you move on. So the third step, don't solve. This is often the most challenging part. Your mind will offer you questions. What does it mean? Why did it happen? What if it comes back? How can I be absolutely sure? So rather than arguing with those questions, you can respond, I'm not solving this right now, or I'm willing to leave this unanswered, or simply, maybe, maybe not. This doesn't mean you agree with the thought. It means you're stepping away from the demand to settle it. You're allowing some uncertainty to exist without carrying out the usual checking or reassurance. And the fourth step is return. You simply bring your attention back to something in the present. Return to the conversation you were having. Return to the work you were doing. Return to the program you're watching. Return to the feeling of your feet against the floor. Return to what you can see and hear around you. Now, the thought may still be present in the background, and that's fine. But you don't have to wait for it to disappear before continuing with your day. You're not trying to create a perfectly calm mind here. You're practicing the ability to continue while the mind still produces noise. So let's try that together. You don't need to bring up your most upsetting thought here, okay? Use a mild worry or simply imagine that an unwanted thought has appeared. So notice what your mind wants you to do. Does it want you to analyze it, check, review a memory, search online? Does it want you to ask someone for reassurance or replace the thought? Or monitor how your body reacts? Just notice what urge it brings. And quietly say to yourself, this is just an intrusive thought. I do not need to solve it right now. This is just an intrusive thought. I don't need to solve it right now. Then bring your attention to the room around you. You can notice one thing you can see. Notice one sound. Notice the physical support beneath your body. And you can take one gentle breath in and just let that go. And then simply return to whatever you were doing before the thought interrupted you. Now, you may not feel immediate relief. And that's really important to understand, because the purpose of this exercise is not to make the anxiety vanish within seconds. If you use it to check whether you feel better, that checking can be part of the same cycle. The aim is to teach your mind that you can experience an unwanted thought without entering into an investigation about it. You're practicing a new response. And new responses become more natural through repetition. So at first, the thought may return quickly. The mind might say, but you still haven't answered the question. And you can respond in the same way. I know. I'm leaving it unanswered. Then return your attention again. A minute later, the thought may return. There is that thought again. I'm not solving it right now. And you return again. And this repetition is the practice. Each time you choose not to check or argue or neutralize or seek certainty, you're showing the brain that the thought does not require an emergency response. It's also important to recognize that compulsions are not always visible. When people hear the word compulsion, they may imagine repeated hand washing or checking locks or arranging things. But compulsions can also happen entirely inside the mind. You may mentally review a conversation. You may test your memory. You may replay an event to make sure nothing happened. You might monitor your feelings. You might try to replace a bad image with a good one. You might repeat reassuring phrases. You might be comparing people with yourself. You may repeatedly search for the correct explanation all the time. And because these actions happen silently, they can be difficult to recognize. But the useful question is, what am I doing in response to this thought? And does it give me short-term relief but keep me coming back for more certainty? And this does not mean you must suddenly stop every response perfectly. Turning it into another rule can create more pressure. Just begin by noticing one part of your usual pattern. Perhaps you delay checking for 5 minutes. Perhaps you avoid searching online for one answer. Perhaps you allow one question to remain unfinished. Perhaps you return to your activity even though you don't yet feel completely settled. Small changes matter, and remember that thoughts do not have to feel unimportant before you treat them as unimportant. You may still feel anxiety. The thought may still feel urgent. But you can choose not to organize your behavior around that urgency. Feelings can be present without being in charge. The thought can be present without becoming the center of your day. So when intrusive thoughts are frequent, very distressing, take up a great deal of time, or lead to repeated check-in or avoidance, they can sometimes form part of obsessive compulsive disorders, usually known as OCD. That doesn't mean everyone who experiences an intrusive thought has OCD. But if this pattern is interfering with your work and sleep or relationships or normal activities, it's worth speaking to your GP or a qualified mental health professional. OCD is not simply being tidy or liking things in a particular order. It can involve painful, unwanted thoughts and exhausting attempts to gain relief or certainty. Effective treatment is available, particularly CBT, that includes exposure therapy and response prevention, usually shortened to ERP. That process helps people face intrusive thoughts and uncomfortable uncertainty while gradually reducing the compulsive responses that keep the cycle going. You don't have to diagnose yourself, and you do not need to manage severe symptoms alone. Just for now, remember the 4 parts of today's reset. Notice, name, don't solve, return. Notice that a thought has appeared. Name the process without analysing the content. Allow the question to remain unanswered. Then return your attention to the life happening around you. The aim is not to win an argument with the thought. The aim is to stop giving the argument all of your time and attention. An intrusive thought may feel loud, it may feel urgent, it may create a strong physical reaction. But you can gradually learn that you do not have to respond to every thought your mind produces. So thank you for listening to the Anxiety Reset podcast. I'm Neil Robson from Faversham Hypnotherapy, and you can find more episodes and short anxiety videos on the YouTube and TikTok. You can search for the Anxiety Reset or follow at the Anxiety Reset 1. You can also email the podcast at anxietyreset1@gmail.com. So for information about hypnotherapy for anxiety and sleep, visit Faversham Hypnotherapy. In the next episode, we'll look at reassurance, why it can make you feel better for a few minutes, but leave anxiety asking the same question again later. So until then, remember, you don't have to answer every thought. You don't have to achieve complete certainty. Notice it, name it, leave it unanswered, and return to the present moment. Thank you for listening.